Good afternoon, and thank you for joining us today. We know how busy schools are at this time of the year, so we appreciate your taking the time to join us. My name is Jolene Bracale, and I'm here with Carol Gillette.
My name is Carol Gillette. I'm the Coordinated School Health Specialist here at the Indiana Department of Education. Thank you for joining us today.
We're going to go ahead and get started, and I'd like to welcome you to the School Nurse webinar regarding an update on the current and new laws that deal with health issues in the schools. I know that many of the people joining us today may not be school nurses, but they might be school administrators, health and PE teachers, coaches, athletic trainers, and even others. I want to thank you for your interest in this topic, and I hope that you find this webinar helpful to you. This webinar is going to be fairly technical, and we will move very quickly through the various old and new laws. As such, this webinar is meant to be an overview regarding the health legislation. More information, frequently asked question documents, and sample forms are posted on the DOE Health website to assist you in implementing these laws. If you have questions as we are discussing these laws, you are free to email us your questions at doequestions@gmail.com. However, if we do not have a chance to answer all of your questions, please note that several new frequently asked question documents have been developed regarding the implementation of several of these new laws, and they've been posted and they are available on our website. I'd like to start this webinar with a brief review of Indiana Code 2034. All of the legislation that deals with school issues is located under Title 20, which is part of the code that falls under the jurisdiction of the Indiana Department of Education. Thus, any Indiana code that begins with the numbers 20 is referred to as the Education Code. The next number in the Indiana Code further subdivides the information into a subcategory under the title. Almost all of the issues that deal with the health and safety of students can be found under Indiana Code 2034. That is the area that we're going to discuss today, which is Title 20 and Article 34. As of 2013, Indiana Code 2034 consisted of 7 chapters. All 7 chapters have been listed on this slide. Chapters 1, 2, and 6 were not changed in the last legislative session, and I am not going to discuss these chapters in today's webinar. We are going to look at chapters 3, 4, 5, and 7, as well as 2 new chapters that have been added. So here's what's new. Chapter 3 was changed last year and resulted in new vision requirements and a new school health report, which each accredited school should be completing at this time. Chapters 4 and 7 had some changes in the last session, and chapters 4.5 and 8 are new chapters that were added this year. So as you can see, Indiana Code 2034 has undergone quite a few changes recently, and we are going to discuss these changes today. Let's start with Chapter 3. If you look at the Indiana Code listed on this slide, it's like a bookmark. It gives you a page number in the Indiana Code, which is thousands of pages of how you can find the different laws. This is like their title or their name. So Indiana Code 2034-3 deals with the components of a school's health and safety program. Chapter 3 has several sections that deal with children's health, such as vision, hearing, and medication. Most of the laws in Chapter 3 did not change. Only the vision requirements have changed recently. Thus, most of this section of the presentation will be a quick review of the laws that have been in existence for a few years. Section 3 deals with a medical exemption and must contain a statement from the licensed healthcare provider that the immunization, which is usually what a medical exemption is for, is detrimental to the student's health. A form for the provider to complete regarding a medical exemption can be found on the DOE Health website. Section 7 of this law gives a school the options to jointly employ medical personnel, such as a school nurse coordinator between 2 school corporations or a town. Indiana Code 511 states that each school corporation must employ at least 1 registered nurse with a bachelor's degree in science to coordinate school health services. Section 9 gives the school authority to exclude students who are ill and explains when they can return to school. If there is a disagreement between a school or a school and a parent or a school and a provider, this code leaves the final authority up to the local health officer to determine when the child can return to school. Section 12 of this code is the vision testing code. It was changed in the 2013 legislative session, and it went into effect for the 2013-14 school year. These changes added near vision to the school requirements. It added a mandatory grade 5 that was required for screening, and it changed the reporting requirements for schools and DOE. These new requirements are what led to the development of the new school health report that the school nurses should be completing now regarding their data for vision screening, hearing screening, and immunization verification. This report and this legislation is located on the DOE online. Instructions on how to obtain a password, how to enter your data into the report, and a short 10-minute webinar can all be found on the DOE Health website or on the School Nurse Learning Connection. This report is due for all accredited public, charter, and private schools by June 15th. I know I looked today and about half of the schools have completed their report, so about 50% still need to complete this and enter it into the DOE online by June 15th. Section 14 describes the mandate for hearing testing, which is required for all students in grades 1, 4, 7, and 10. Hearing screening data is also part of the new school health report that schools should be completing at this time. Section 18 deals with the release of medication and states that the medication can be released to a parent or to an individual over the age of 18 or to the student if the parent sends written permission to the school. Your own school policy can be more strict than the law, but it cannot be less strict than what the law requires. Section 19 of this code describes the circumstances where eye protection is required. This slide lists the time where you have to have eye protection when participating in activities. And finally, Section 20 of this code describes that schools are required to conduct monthly fire drills and at least one tornado and one man-made disaster drill each semester. This is where a lot of the schools with this man-made disaster requirement do things for school safety, such as lockdown drills. We have just reviewed the highlights under Chapter 3. Let's now move on and look at Chapter 4. So if you look at this slide here, it shows you all of the different chapters we're talking about. We did Chapter 3, Health and Safety Measures, and now we're going to move on to Chapter 4. This next chapter is called Indiana Code 2034, and it's Chapter 4, and it deals with the topic of immunizations. Some of the highlights of this chapter include that schools must have an immunization record for every enrolled student. It also states that students must be allowed to enroll but may not attend school if they do not have the proper immunizations. The required immunizations for school attendance are determined by the Indiana State Department of Health. In this slide, things that you have to know about immunizations is there's really 4 words. It's an enroll versus attend, and exclude versus expel. Students that do not have the proper immunizations are allowed to enroll, but they should not be allowed to attend, and they are not expelled from school. That has a whole due process with it. They would be excluded from school due to a health reason. Schools do have the option to grant students a waiver to allow parents 20 days to supply a completed immunization record to the school. Thus, students may attend if they meet one of these following requirements. If they have a complete immunization record, they are in the process of completing their immunizations, and they have an appointment scheduled with a provider to finish the remainder of those immunizations. Category 3, they have a medical exemption on file, or 4, they have a religious objection. Information regarding the immunization status for each student is required for this new student school health report that's due this year. This is a list of all of the immunizations that are required for our Indiana students. Again, this list is done by the Indiana Department of Health. This past school year, all students were required to have 2 chickenpox vaccines. All of your students should now meet this requirement. For the upcoming school year, the new requirements include 2 hepatitis A vaccines for all kindergarten students and a meningitis booster for all seniors. These 2 new requirements are what schools should be messaging out to parents at this time, and what school nurses should be making a list of regarding who is not complete for the fall. Please note that the hepatitis A vaccines must be given at least 6 months apart, and that the MCV booster is only required for those students who receive their first MCV vaccine before the age of 16. If you have questions about the immunizations, there is a frequently asked questions document posted on our website, as well as a lot of other useful materials, and on the CHIRP website from the Department of Health. So we've looked at chapters 3 and we've looked at chapters 4. So let's move on to a new chapter, which is chapter 4.5. This new chapter 4.5 created the new epinephrine law in this section of the Indiana Code. There are 2 auto-injectable medications available, and these include the Auvi-Q, which is the one that talks to you, and the EpiPen. Indiana Code 2034 4.5 allows a school the opportunity to stock and store a dose of epinephrine, which can be used in an emergency situation. This law does not require schools to stock epinephrine. It just allows schools to do so if they choose to, and if they have the proper procedures in place to safely administer this medication. This law says that schools may fill the prescription. It does not say that they must. After they do have it, though, the law does say that schools must store the epinephrine in a safe location so that the school personnel have access to it. This law states that the school nurse may administer epinephrine to any person. That means a student, a staff member, or a visitor that is exhibiting signs of a life-threatening allergic reaction, and the individual does not have an epinephrine at the school, or when the individual's prescription is not available. This law also allows a school employee to administer the stock epinephrine to a student, staff member, or visitor who is demonstrating signs of a life-threatening anaphylaxis and the individual's prescription is not available if they're not available. But also, the law states that the employee must volunteer, and they must receive training from a healthcare provider who is knowledgeable in recognizing the symptoms of anaphylaxis and the administration of epinephrine. So this would be someone that would be such as the school nurse, because they are knowledgeable in recognizing anaphylaxis, and they do know how, and they have been trained in the administration of epinephrine. This new law allows a healthcare provider to write a prescription and a protocol for epinephrine to the school, and for a pharmacist to dispense the medication to the school. This new law was unusual. Most of the time, standing orders in a hospital have the physician has written it to a nursing unit or to nurses. In this particular bill and the law, we actually wrote into it that the doctor could actually write the prescription to a school building, and that it allowed the pharmacist to actually dispense it to the school or school district, and that it could be filled. And since those were unusual circumstances, we had to write them into the law to give both of those permission to do so. This law also gives the liability protection to school employees that administer the epinephrine, and to the healthcare provider who writes the prescription or provides the training. There are several items that you should consider before you should stock a dose of epinephrine. These items include a school policy regarding who can administer it, under what circumstances can the epinephrine be administered, where the medication will be stored, purchasing the proper dosage, whether you have an EpiPen Junior or an EpiPen for adults, ensuring consistency by having the medication available in each of your schools so that you have the same standard of care. You'll want to know who would be doing the training and have some parameters around that. How the school should develop procedures to avoid allergic triggers through the writing and delegation of an individual health plan. All of these items that really should be in place before you go to the next step of having a stock epinephrine. Several guidance documents, such as the ones listed here, have been posted on the School Nurse Learning Connection to help you implement this law. Some of these items are the sample standing order. It's posted on the School Nurse Learning Connection. A form to complete if epinephrine has been used, so you administer it in your school. There's a 2-page form that asks a lot of information about the person that it was administered to, how long did they have their signs and symptoms, what happened to them, what were they allergic to, different items that we're just going to collect data on, and we'd like you to keep it in their school, in their record or at the school, and please send a copy to me at the Department of Ed. And also the CDC has published a document that's called Voluntary Guidelines for Managing Food Allergies in Schools and Early Care and Educational Programs. It's a fairly lengthy document, about 114 pages, but it's a great, excellent document. And the National Association of School Nurses has got a checklist or a quick outline of the most important parts of that document, and that's all posted on the School Nurse Learning Connection under the files and bookmarks. Okay, I wanted to take a quick break here just to give you a breather and to remind you that you are free to email questions to us during this webinar. The email address is idoequestions@gmail.com. I hope that we'll have some time to answer some questions at the end of the session. So we've looked at chapters 3, which was the health and safety measures, and it had quite a few different things in there, such as vision and hearing, medication, ill students, the religious and medical exemptions. They're all found under the health and safety measures. Then we looked at immunizations and a few of the requirements of that. And then we looked at 4.5, which is epinephrine. Now we're going to look at Chapter 5, which is the care of students with diabetes. This chapter has not been changed, and so we'll review it fairly quickly. This law requires that all students with diabetes have a diabetes management and treatment plan, and that this plan must identify the health services needed for the student at school. It must evaluate the ability of the student to self-manage their own care, and it must be signed by the healthcare provider and the parent, and it must be submitted to the school nurse. Next, the law requires the school nurse to use the diabetes management and treatment plan and develop an individual health plan for each student with diabetes. This individual health plan must be developed by the school nurse, and it delineates the health care that the student will receive during the school day and at school activities, and it must incorporate the components of the management and treatment plan. The law allows for the use of a volunteer health aide, and it states that it is the responsibility of the school principal, in consultation with the school nurse, to seek school employees to serve in this role, and that the volunteer health aide must have access to the school nurse either in person or by phone as questions or issues arise. The law describes 2 types of training, one for the school nurse and one for the volunteer health aide. The school nurse training is available on the DOE Moodle and includes videos, PowerPoint presentations, quizzes, and a certificate. The voluntary health aide training, which is new this year, consists of a PowerPoint with embedded videos and handouts. This VHA training is available on the DOE Health website, and it's a PowerPoint that you can put up and show there for any of your volunteer health aides, but the instructions are on the school nurse learning connection for the school nurse to actually look at all of the training materials, download some of the handouts. There's some quizzes and an information sheet, and the test results are all on the School Nurse Learning Connection. This diabetes law acknowledges that a school nurse would be the first choice to perform the health tasks needed to care for a student with diabetes, but that a voluntary health aide may be used if the person volunteers and is comfortable performing these tasks. The law also states that the parent must agree to having the volunteer health aide provide these healthcare tasks for their child. The law allows the student to self-manage and requires the school nurse to establish emergency procedures for the student, even if the students are self-managing. They do not need a full health care plan because the student actually does all of their own care, but the school is still required to have an emergency procedure in place in case the student is having difficulty. Lastly, this law requires an emergency information sheet to be given to the school employee that is in charge of the students with diabetes if they are at an off-campus school activity. This information sheet must identify the student and have appropriate response if there is an emergency and emergency contact information so that they understand how to take care of the student if the school nurse isn't there and they're at an off-campus activity such as a field trip or an extracurricular activity in the evening. They're part of a sports team or a math bowl or things like that. Okay, this was a quick review of Chapter 5 as there were no changes to that law during the last session. Now let's look at the changes that occurred to Chapter 7. Chapter 7 is Indiana Code 2034-7. This law deals with student athletes and the education, management, and prevention of concussions. First, this law states that before beginning practice for an interscholastic or an intramural high school sport, each student and each of their parents must be given an information sheet and they must sign a form acknowledging receipt of the information. The law states that if a high school athlete is suspected of sustaining a concussion, they must be removed from play and they cannot return to play until the athlete has received a written clearance from a healthcare provider trained in the evaluation and management of concussions. There are several new additions to this law for the upcoming school year. First, an athlete must wait at least 24 hours before they can return to play, even if they have a signed release. So once a concussion is suspected, the athlete is removed from play, and two things now must occur before that athlete can return to play. First and foremost, at least 24 hours must have elapsed, and the athlete must have a written release from a licensed healthcare provider trained in the evaluation and management of concussions. So even if they are pulled from a game and there's a licensed healthcare provider on the sidelines and they sign their release, they still have to sit out 24 hours before they can return to play or practice due to this new law. Next, all football coaches in the state of Indiana are now required to take a certification course. This certification course does not apply only to high school football coaches. It applies to all football coaches, and the way the law is defined is that if a football coach coaches students or children under the age of 20 and who play or practice on public fields. So if you are, the first question would be, are you a football coach? Because it only applies to the sport of football. Then do you coach children or students under the age of 20? And then do you practice or play on public fields? Even if you are a private school and you have an away game and you play on a public field, this law applies to you. Information regarding this law, some sample forms, all of the information sheets that are required that you give to parents and to students, a new frequently asked questions document. All of these items are available and have been updated on the DOE Health website. They're also posted on the Concussion Learning Connection. The DOE and the Concussion Advisory Board are in the process of reviewing courses that have been submitted to us. We are aware of the tight time frame for football coaches, and we are working diligently with many stakeholders on this process. As courses are approved, they will be promptly posted on the DOE Health website and on the Concussion Learning Connection. During the last legislative session, House Bill 1290 and House Bill 1202 were actually combined by the legislators, and they were passed into law under one bill called House Enrolled Act 1290. This new law actually has 5 different sections to it, and these 5 different sections apply to 5 different areas of Indiana Code. The first section of this law applies to Indiana Code 16, which deals with the definition of a healthcare provider. There is a list of professions defined in Title 16 that meet the definition as a healthcare provider, and under this bill, athletic trainers have now been added to this list. Section 2 of this law falls under Indiana Code 2030, which is under Title 20, which is education, and Article 30, which is curriculum. I know we've been talking today about 2034, which is education and health. Indiana Code 2030 is education and curriculum. This law states that high school students must receive training in CPR and AED in their health class. It includes an education piece on these topics as well as a psychomotor skills component, which means a hands-on piece with a mannequin. The law states that the instructional materials must come from a nationally recognized organization. The law, if you looked at it earlier, it looked like it was going to be a graduation requirement, and that every student graduating from high school had to have the CPR course. It was altered just a little bit before it was passed, and instead of it listing it as a graduation requirement, it is listing it as a high school health requirement. So if any high school students takes a health class, this CPR and AED course has to be added to it. Section 2 further goes on to explain the requirements for this course and states that the instruction can be done by a teacher or a volunteer, and that the instructor is not required to be a certified CPR instructor. The law also states that this instruction does not require a student to become CPR certified. They do not have to take a test, they do not have to get a card, and it does not have to fall under all of the requirements of a CPR certification class. If a school is not able to provide this hands-on component regarding the CPR and AED instruction, which means having mannequins for the children to practice on, then a waiver is available and can be found on the DOE Health website. Schools can also find on the Health website a new frequently asked questions document about this law, and it will help you answer some of your questions if you have any. Section 3 of House Enrolled Act 1290 adds a new chapter to Indiana Code 2034, and Section 3 is the only part of this law that actually deals with the code that we've been talking about today. So here is where this will fit. House Enrolled Act 1290 will become Indiana Code 2034, and it will be a new Chapter 8. So let's take a look at this law, which will be the sudden cardiac arrest law. Sudden cardiac arrest is not the same as a heart attack. Sudden cardiac arrest is an electrical problem with the heart, and a heart attack usually occurs due to a blocked artery. The end result is the same in that the heart stops, but the causative factor is different in each of these situations. Indiana Code 2034-8 applies to all accredited schools, and it refers to competitive athletic contests, including intramural sports and cheerleading, and it will become effective July of 2015. The language and the requirements are similar to the concussion law in regards to the education forms and an acknowledgement form that has to go out to parents. It is a little bit different in that it talks about who it applies to, in that it includes cheerleading. It doesn't say interscholastic, it says competitive athletic contests, and then it also says intramural sports. It also does not say high school, it says all students. Also, though, like the concussion law, if an athlete is suspected of experiencing symptoms of a sudden cardiac arrest, the student should be removed from play. But unlike the concussion law, the student is not required to see a licensed healthcare provider trained in the evaluation and management of sudden cardiac arrest. Instead, it is left up to the parent to determine if the student should be seen by a provider, what kind of provider that should be, and when they should be allowed to return to play. The reason for this is that the symptoms of sudden cardiac arrest can be due to a variety of circumstances. So the intention of this law is for the procedure to be that the coach is able to recognize symptoms that might be attributed to sudden cardiac arrest, for the coach to remove the student from play, for the coach to notify the parent, and to obtain the parent's verbal and written permission before the student is allowed to return to play. More information will be sent out about all of this as the time gets closer to July of 2015. Sample forms similar to the concussion forms will be developed by the DOE, and they'll be posted on the health website in early 2015. Schools, however, are able to develop their own forms ahead of time if they would like. Section 4 of House Enrolled Act 1290 deals with Indiana Code 21 and adds the sudden cardiac arrest requirement for athletes who attend higher post-secondary education institutions. So it's the sudden cardiac arrest, but it's meant for colleges, and so it's a different section of this bill. There was another section of when we talked about the epinephrine law, instead of them combining the schools K through 12 and post-secondary into one law, such as this one did for sudden cardiac arrest, that bill, there's actually two separate laws. One that was applied to K through 12 and another one that applied to secondary, but there is a law for the ability to stock epinephrine for colleges also. It was just a separate bill than Senate Enrolled Act 245. Section 5 of Indiana Code 25, which is the Health Enrolled Act 1290, Section 5 amends Title 25, which deals with professional licensing code, and it adds the athletic trainers to the list of professionals who are required to have a national criminal background check. There are a few other items of importance that I would like to share with you today before I conclude this presentation. First of all, I would like to take a moment to talk with you about the Massachusetts study, as the results of this study were just released last week. The study was conducted by the CDC and Massachusetts, and it involved a program that put full-time school nurses in schools and studied the cost effectiveness of this program. The researchers found that for every $1 spent, $2.20 was saved in medical bills, parent wages, and teachers' time. The researchers found that teachers spent 20 fewer minutes each day dealing with student health issues once a school nurse was assigned to their building. This program estimated that the cost of having full-time school nurses in the study was $79 million, but that the money saved was $177.2 million. The money saved was related to the amount of money that the same medical services would cost outside the school district, which was $20 million. They also added in the amount of money saved in parent productivity, which meant they had to come to school to pick up their child or bring them home, or left work to care for a child, which was $28.1 million. And the direct benefit to the school was a savings of $129.1 million due to the teacher productivity and having the ability to focus on teaching as opposed to dealing with student health issues. So they added in 20 minutes of lost teacher time, in that the children might come up and have a health issue that needed to be addressed, talk to the teacher about not feeling well. All of that they added was a minimum of 20 minutes per day per teacher, and that lost productivity added up to schools to be $129.1 million. Ann Sheets, who was the senior author of this, made the following comments. First, she stated, "I could not believe the amount of health care that was being done in schools and the critical nature of it." And she followed this by saying that school nurses see 60 to 70 kids each day, that they have to be ready to provide emergency care, mental health services, and help manage chronic conditions like diabetes. Nurses are also charged with teaching other members of the school community about issues such as life-threatening food and allergies. This study done in Massachusetts demonstrates the health needs of students, and our Indiana legislation reflects these same needs, as we have seen today with our diabetes legislation, our epinephrine legislation, the concussion and sudden cardiac arrest legislation, and our new school health report. A few other items of importance that I would like to share with you before I conclude this presentation would be the following. One, that although it's not a new Indiana law, I did want to let you know about a new federal rule that will be required for schools who participate in the National School Lunch or Breakfast Program. The rule states that all food and beverages sold to students during the school day must meet certain requirements. The rule does not apply to food and beverages brought to school for lunch sold in after-school bake sales or fundraisers, or food sold only to adults. More information about this rule can be found on the School Nutrition DOE website listed on this slide. If you are a new school nurse with less than 2 years of experience, please come and join us for the 2-day new school nurse orientation that will take place on July 29th and 30th. The link to register is listed above and is also posted on the School Nurse Learning Connection. The orientation is free of charge, but participants will be responsible for their own travel, hotel, and meals. More information regarding the topic, location, and speakers can be found at this same website. As we have discussed today, there is a new school health report this year. It is found on the DOE online, and that's not the main DOE website. It's a whole separate program or area on the Department of Ed's website. It's called DOE Online, and this report will apply to all accredited schools. The reports ask for data regarding vision screening, hearing screening, and immunization verification. The report will close on June 15th, and instructions on how to complete the report can be found on the DOE Health website. Okay, I think that's about the basic overview of all of these laws. I know that there is a lot of questions. There's a lot more information that we could go through on each of the laws, and each one of them probably could take a full session of questions and answers of all of the details of them. Today's session was really to give you an overview of all of these laws, tell you where all of the documents have been posted, give you a little bit of overview so that you knew these new laws existed and how to find the resources and materials, and give you a little bit of an opportunity to ask some questions. So let's look and see, do we have any questions that have started?
Jolene, we're going to give a few moments for people to submit their questions to idoquestions@gmail.com. Our first question is, should school districts be concerned about legal ramifications of choosing not to stock epinephrine? This school does not stock any medications.
That's a really good question, and it really is up to the school. As we were talking to legislators about this law, that was one of the points that the Department of Ed was very adamant about, in that the laws say that schools may stock epinephrine and not must, because you would have the liability if the law said that each school must have a stock dose of epinephrine. If you didn't stock it, you would have some liability there because it was a law and you were breaking the law by not stocking it. The way the law is written is it says that schools may, if they can find a physician that will write the order, if they have if they have a school nurse that is either there full-time that can administer it, or there are people willing to be trained, and they have to volunteer to be trained, and that you have all of the pieces in place that go with having a stock dose of epinephrine. So there's a lot of pieces, and the first part of that is developing a policy, making sure that you have a physician that would write the order, that they write the order in such a way that it gives a protocol along with that. What are the symptoms? When is it appropriate to give the epinephrine? How are they going to give it? They should always call 911 anytime epinephrine was given, even if the student recovers and seems to be fine. Even if the parent, if you call the parent and they say, oh, I'm sure they're fine, they really didn't need it, they come and check it, a 911 call should be part of the procedure. And then what happens when the school nurse isn't there? How do they delegate that? Are there people that will volunteer to do this training and be a part of it? So there's lots of things to consider. Until you have all of those things in place, I don't think you have any liability with this law of not stocking it, because you can say, this is really an enabling law. If you have all the pieces and you would like to do it, this law covers some of your liability and helps you, helps the physician be able to provide the epinephrine, helps the pharmacist to be able to fill the prescription, helps the school to be able to have it, only if they choose. If a school does not want to have that, then they can cite the fact that they didn't have all the pieces in place. It was not their school policy. Their school board discussed it and determined that in their unique situation, they didn't feel like it was something that their school really felt like they could implement well or safely, so they chose not to have a stock epi. So there really isn't a liability of not having it. It's really if you have all the pieces in place that you can do it safely.
Good. Our next question is, what if the student has already completed their health course and it does not include CPR and AED information? Are they not included? Does the instruction for CPR and AED begin with the 2014-15 school year? Some
of this is in that frequently asked document. Some of the questions that have come out are that some schools used their 8th grade health course and they taught CPR. Does that count? And the answer is no. We ask our curriculum, we ask our lawyers here at the Department of Ed, and because the way the law is written is that it's a high school health requirement. So if you have an 8th grade course and it counts as the student's high school health requirement, which most of them don't, because that would be almost like one course satisfying 2 requirements, because 8th grade has a health requirement. Most 8th grade health courses having the CPR course does not meet the requirements of this law. That's one question. Then the second part of it, it starts with the 2014-2015 school system, and so we have been asked, does it start with a senior class cohort? And the answer to that is, if it was a graduation requirement, yes, you would have had to gone back and look at all of the kids to make sure that they had a CPR requirement, but that's not the way the law was written. The law was written that it has to be in a high school health course. So beginning with this next school year, our recommendation is most schools have a freshman high school health course, and you should begin offering the CPR course in that course for the coming school year. So you don't have to go back and find kids that have already taken the health course in the past years. It just starts going forward. It needs to be included. And there are 2 pieces of it. One is the education, which would be a video or a instruction piece of it. And then there's the psychomotor and the hands-on mannequin practice piece of it. The education is required, and that's part of the law. The psychomotor, as we discussed with the legislators, we knew that might be rather difficult for schools to implement this quickly, and so a waiver is in place. If you are not able to do the psychomotor piece, there is this form that you can fill out. It asks for the school. It asks, how did you attempt? What were your options? Did you try to borrow it from other agencies such as the health department, a fire department? Did you already have them and you moved your CPR from 8th grade to 9th grade? What options did you have that you actually tried to implement this law? And then if you were not successful, why are you requesting the waiver? And submit that to the Department of Ed just for the hands-on psychomotor piece of it. Does that answer all of those questions that were in there?
That were similar to that. There is one nurse that would like to know if she would be able to get a copy of this slide presentation.
There won't be a copy of it, but it will be archived. It's a live webinar, and so it will be posted on this website, and you can download it. Most of the information that's on here will be, like I said, there's frequently asked questions and documents. So for all of the new laws, you can actually go down, you can download them from the Indiana Department of Ed. If you go into the website, go to school health, and then on the health website, there lists different ones. One of them is concussions. One of them is CPR. There's an immunization section. There's all of the different topics that we've talked about. There are resources, guidelines, copies of the laws that you can download for you to look at.
And we had one more question come in. Is there a time requirement for the CPR AED curriculum in class? How long do we need to spend on it?
That again, is a really good question. The law does not specify the length of it. It does say that you have to use reputable materials from a national agency or organization, such as materials from the American Heart Association, from the American Red Cross. That does not specify a length of time, and it does not specify that the instructor has to be CPR, an instructor certification. Doesn't say that the students are certified after that. So it's really using your judgment of covering the topic and including it. I do know that the American Heart Association and the Red Cross, they do have videos and DVDs that you can purchase. There are some materials online, such as YouTube, that you can look at that schools can use to educate students about CPR and AED.
We have one other question here, and who can apply for the CPR waiver?
Any school. The idea between the idea of the CPR waiver is that all of the agencies that I mentioned earlier, fire departments, health departments, hospitals, some private companies that would like to donate money to schools for this because they are sponsors of organizations that have to do with heart and the health of children. There are some organizations that have come to the legislators and said, we'd really like to assist schools with this. We really feel strongly that having CPR in schools for high school students is a worthwhile cause. And so they would like to donate to the schools so that they can help provide these mannequins. So really the purpose of the waiver is to get a list of schools that are not able to provide these materials. That we're not really sure at this end from the Department of Ed. Schools, there might be a majority of the schools that already have access to CPR equipment such as the mannequins. They may have a system in place. They may already have purchased them. They may be able to use them in their 8th grade classes had them. They may be able to borrow them for 9th grade. So really the waivers for any high school that needs to meet this requirement of having the CPR in their health class. If they're not able to have access to the mannequins, there is no limit or requirement of which schools can apply and which ones can't. And then at the end of the year, we'll look at all of the schools to see if we can't help them by providing mannequins for them through different resources that we might be able to find at the state level.
We're going to take a few seconds here while other questions are coming in through the Gmail.
One of the questions here, it says, define the health officer. That's a great question, and every county should have one. There are 92 counties in the state of Indiana, and they're lumped together under their health department. So there might be several different school districts or different cities all together under one county. Each county has a local health department, and each local health department is staffed or under the direction of the local health officer. So I know in a lot of counties in the state, they don't have a corporation physician, and they have come to me in the past and said, how are we able to get a stock epinephrine? Because schools have had them in the past, even though this law didn't exist at the time. So one of the places that we referred them to was the local health officer. And so you would call up your local health department. You can talk and ask for the name of the local health officer. That's a physician that's in charge of the county, and they would be able to talk with you about could they write a prescription for an epinephrine if they would be willing to. They're certainly part of that, and on the group that actually helped propose this legislation was the physician at the Indiana Department of Health, and so the health officers were aware of that or represented on the committee about that they are people that could write this. And then also if people are ill and there is a discrepancy of whether that person is contagious or should be excluded from school, let's say there's an immunization outbreak of chickenpox and certain students are excluded from school, they do that under the direction of the health department, under the direction of the local health officer. So the definition of a local health officer is it's a physician that works at the local health department. The next question here says, just to confirm, they're asking, does the DOE support not allowing students to begin the school year without proof of immunizations? There is the law, and I think actually as I look back, I think I skipped a slide or two under immunizations. I advanced it. There was one slide that talked about the 20-day waiver, and I don't think we covered it today. But there is in the law saying that students should not attend the first day of school without proper immunizations unless they've been granted a waiver. That is up to the school district. The law allows a 20-day waiver for parents to get their immunization record into the school. And then after that time, students should be excluded from school and they should not be allowed to attend unless they have the proper immunizations. And again, proper immunizations doesn't mean that they have to be all complete. It means they have to fit in one of those 4 categories, which means they either have to have the appropriate immunizations, they could be in process, which means they have an appointment to get their immunizations. Those students would not be excluded. They would be in process, and that would fit under the law. They have a medical exemption on file, or they have a religious objection on file. all of those would still count as students that are perfectly within the legal limits to attend school. It would be those that you have absolutely no records on. They're not in process. You're not working with them in terms of getting a medical exemption, getting an appointment, that the parent hasn't written a religious objection. Those are all kids that really shouldn't be attending school after the 20-day waiver because they have not completed their immunizations.
Jolene, what would your recommendations be for schools that are having difficulty completing the MCT portion of the vision exam? Mm-hmm. Are there any recommendations as far as helping them get this completed?
That was a part of the new law a year ago, and so last summer at this time was the requirement that the MCT portion of the vision screening be done by an eye physician or a licensed eye professional. And that really changed the school health report because the schools are required to report a lot of things about MCT that they weren't required to before, and the Department of Ed is required to report to the legislator this next fall about all of the results that we had for this past session. So one is that we collected a lot more information from schools, and then the best piece of help that we could offer them locally was that there was a form that schools could fill out on the Optometrist Society's webpage saying, we're school XYZ, we live in this county, and we were having difficulty finding an eye doctor to help us with this. Could you help that? And I know the eye doctors are in the process of trying to talk with their members, encourage them to assist in schools, and they were able to find, I know, some eye doctors to help schools when they filled out this report. So the best advice that I can give you is to you contact local eye doctors in your area, see if any of them are willing. If not, contact the Optometry Society and say, and you can fill out their form that's on their website, or call them and say, this is the school, I'm having trouble finding an eye physician. A law has been passed requiring schools to do this. Could you help us in this area? Mm-hmm. That's the best advice, to ask the eye professional societies to encourage their members to help schools.
Okay. Is there an annual order that's needed for stock epinephrine?
Ooh, it doesn't, that's a good question. It doesn't address that in the law, saying that the order has to be done on an annual basis. I know that in my experience, I did have stock epi at my building, and I did have that every year. As there were several things that we had our corporation physician that allowed us to do, and we had them review that every year. There was a list of items that our clinic could stock, and our corporation physician reviewed that list. There were some things that they would out or add each school year, and they would, as part of that procedure protocols, sometimes we would add different ones in. So every year we had our physician look over all of our standing orders, our procedures, what we stocked in the clinics, and he did rewrite an order every year and update it and said yes, they were approved for that school year. So my best practice recommendation would be that the standing order be done every school year.
This nurse would like to know if there are companies that are giving away free epinephrine, and we do have some links on our website in the Learning Connection under Files and Bookmarks, Chronic Conditions, and under Allergies, Severe Allergies, and there's some links there that may be helpful for you.
There is a program for EpiPens, and the schools can fill out a form, and they will provide several free EpiPens to the school. I'm not sure how much longer that program will be in existence. I know it will be for this upcoming school year. The company that provides that has stated that that program will still be in existence, at least for the next school year. And for the ABQs, the talking epinephrine, there isn't a free site that I'm aware of, but they do have, if you contact their company, they will give you a co-payment off or a coupon that you'll get some money off of the price of it, but they won't provide them free.
Does the code that supports the epinephrine only support auto-injectable epinephrine?
Yes.
If they use a vial and syringe?
Yeah, that's a good question too, and we had a long discussion about that. I know that the vials that you have to pre-mix. They are a lot less expensive, and sometimes they don't expire as quickly. But the committee and the legislators felt like having that in a school that was a stock dose that was given by lay personnel in some cases, that it was available to coaches, to teachers, to secretaries, that it was to as a stock epinephrine, that they actually called it an auto-injectable epinephrine. And throughout the whole law, it never says a stock epi. It says auto-injectable. So it must be an EpiPen or an ABQ for it to be in your stock dose. If you have a first aid kit, if you have other things that you use in your school that are part of, let's say you're an athletic trainer and you have that as part of your equipment in your first aid bag, this does not really apply to this stock epinephrine. But when you have stock, it has to be auto-injectable. That's what the law says.
Good question. That is the end of our questions.
It looks like we're almost out of time. I really appreciate all of you joining us today. I know you'll probably have more questions. This website will still be open. You can ask you can ask that. We'll try to answer it there. And we will take all of the questions, and if there are some that are not on our frequently asked documents, we certainly can add them and update the forms that we have there. So I want to really thank you for joining us today. I want to wish you a great end of the school year, and thank you for your time and interest in all of these topics.
Thank you.